Hi everyone, it's Amy Trabert here again. This is part 2 of the Erie County High Risk Team and High Risk Factors. And I'm going to start off this presentation really talking about strangulation. So strangulation, and I'm sure you have all heard choking as well, going hand to hand with strangulation. Strangulation and choking are actually two different things. Strangulation is any external force that is cutting off the oxygen flow from the neck to the brain. Choking is any internal force that's really blocking off oxygen flow from the neck and the brain. The best example of choking is when you're choking on a piece of food. The best example of strangulation can be manually with your hands behind the back. It can also be the most common ways actually with the forearm. You can actually strangle somebody with your foot. If you press your foot on top of somebody's neck, that's strangulation. Strangulation can be done with objects as well, right? So scarves, blankets, rope, that's strangulation, anything externally that's cutting off that oxygen flow. And 99% of domestic violence cases, there's going to be strangulation that has occurred or happened. And it's really important that you're able to identify the difference and be able to identify that what occurred was strangulation when potentially reporting to the police, talking to an attorney, or anyone else that you're working with. So 50% of the time, strangulation leaves no marks or no visible injuries. And this is something that I'm doing a better job in educating our police on. A lot of times people just assume just because the victim doesn't have marks or doesn't visibly have any type of bruising, scratches, different things like that, that they weren't harmed or strangled. And that's actually the complete opposite, because strangulation impacts a lot of things happening internally. Specifically neurologically speaking, there's a lot of different impacts of strangulation. Unconsciousness from strangulation can happen within 5 to 10 seconds. That domestic violence victims that are strangled are 7 times more likely to be killed by the same partner that strangled them. Some common, so if strangulation does leave marks, some common marks are petechiae. So that's the bursting of blood vessels, and it actually looks like a bunch of little red dots in the eyeballs. It actually also happens below the eyelids as well. So I am instructing law enforcement to ask about asking somebody to pull down their eyelids so you can see those dots. The other thing is petechiae can happen in the leg. It can happen in many different parts of the body, behind the ear, in your scalp. Again, it's the bursting of blood vessels. So it's going to look like a bunch of red dots, or sometimes it'll look red or like there's some type of bruising. Having difficulty breathing is another symptom of strangulation, as well as having a persistent cough, a hoarse voice, so talking like this. And those are all pure examples that there was severe damage that was done. Neck, right, redness, fingernail impressions, bruising, swollen tongue, swollen lips, cuts, abrasion, chest pain, coughing, nausea, drooling, headaches. All that stuff are symptoms of strangulation. And what you'll notice actually is that strangulation has very similar symptoms to COVID. So I really ask you to seek out medical attention if you have ever been strangled, whether that had been 20 years ago or whether that had been a couple months ago or maybe it was yesterday. It's very important to get checked out for strangulation because delayed fatality is extremely common. We know that sometimes the damage accumulates over years and then people actually die due to the amount of internal damage that was done because it wasn't seen and tested on when seeking out and never sought out, medical attention. So again, very important thing to know. The other thing that I wanted to mention is that people that are most likely to show any types of marks of strangulation are actually redheads, and that's due to their fair skin type. So just like I mentioned before, strangulation continued. Neurological, psychosocial, delayed fatality is very common. We did a study at the Strangulation Institute, where we found out that somebody had suffered a seizure 3 months after they had been strangled, and that seizure was contributed directly to that strangulation incident due to the autopsy. So again, it's very, very, very important that you are getting checked out if you have been strangled. So the other thing that I wanted to talk about were the resources. And the resources that are available if you have been strangled are a couple of different things. So one, the Family Justice Center, their number is 558-7233, and they are able to provide to you a forensic nurse. And that nurse will actually meet you in person. However, with COVID, things have changed. So the best thing to do is actually to call them ahead of time at that number that I just gave you. And you can talk to a nurse on the phone about exactly what symptoms you've been experiencing and different things like that. And she'll talk to you about the next best steps. It's absolutely free. You do not need insurance, and it's a great thing to get involved in. The other thing is you can always contact your primary care doctor as well. The other, or if obviously you're experiencing all these symptoms right head on, you need to call 911. It is an emergency. The other program that exists is actually embedded in Erie County Medical Center, so in ECMC, and it's called the BRAVE program. And if you ask Tara about it, Tara would be able to provide you the phone number for BRAVE, and you can talk. Talk and see when it would be appropriate for you to come into the hospital setting. The advocate would meet you and in the waiting room, and they could give you kind of an estimated wait time of how long it would take in the hospital, and they would be able to do all of the tests, right? Because doctors, everyone there is very familiar with domestic violence and strangulation and knows the testing that should be done. That is the best resource out there. They do have financial counseling, so if you're worried about your insurance or how you're going to pay for it, or hey, maybe that it's going to go on abuser's insurance, they work through that with you as well. So that's a great resource that exists. And again, if you want to get more involved with that program, I highly suggest that you connect to Tara to make an appointment with that. And this concludes our strangulation segment. So again, if there's any questions, feel free to go to Tara about that phone number, and then any other questions in regards to strangulation, and she can touch base with me.